Hi guys, this is Preeti from Hassan Institute of Medical Science. I am back with another important topic, that is vitiligo. Before saying what is vitiligo, you may not be knowing what is that I am speaking about. First, I'll show the image how it looks. That it is a disease associated with the skin. How it looks. First, I'll show that and then discuss about those points. So it will be easy for you to catch. This is a vitiligo condition. You can see this is a white. You might have seen because it will be affected 1% of the population total. If you have 100 people, one person will be affected by this disease, that is vitiligo. You have seen. I guess you have seen this image. I'll be teaching about the diagnosis, causes, the treatment, how we will get cured by this disease, or this is not curable, but still there are some procedures so that you can cure this disease. That is, first I'll say this is a depigmented condition. Maybe some places it may be hypopigmented also, some sites, but the vitiligo mainly it is a depigmented. Depigmented means pigmentation is produced by the melanocytes. No, there will be a loss of melanocytes or damage to melanocytes, so melanocytes won't be producing any pigment. It won't be giving any color to the skin or hair. So it is a depigmentation of the skin is known as vitiligo. So that lady was appearing very white, no, that paper white color she was appearing. So depigmentation of skin is known as a vitiligo, and it is acquired. Acquired means it is acquired after birth. If it is a congenital, it was present from since the birth, but it is acquired after birth. She acquired, and it is autoimmune diseases. Our own immunity destroys the melanocytes. So it is a acquired autoimmune disease, and these will be associated with many other autoimmune diseases like. Other autoimmune diseases also she is prone to if she is having vitiligo, that is Addison's disease. Addison's disease you can see in this image. This is Addison's disease features, that is hypoglycemia, postural hypotension, and then changes distribution of the body hairs and all. These are associated with Addison disease. Addison disease, what we see, this is a kidney, no? Kidney, on the top of kidney will be having adrenal gland. Adrenal gland will be secreting adrenaline, noradrenaline and all these hormones. If there is a hyposecretion of these hormones, will be having Addison's disease. And diabetes mellitus. Diabetes mellitus, there are two types of diabetes mellitus. Diabetes mellitus type 1 and type 2. Type 1 is mainly insulin deficiency. Insulin is not there. In type 2, even though insulin is there in the blood, but it is not entering the cell. There is a resistance for the insulin. That is type 2 diabetes. Addison, this is like vitiligo is mainly associated with the Addison's disease and diabetes mellitus. And thyroid diseases. Some thyroid diseases will be associated with vitiligo. I already told you 1% of the population is affected by this disease. And the causes for this vitiligo may be genetic deposit. Maybe the parents or grandparents might be having this vitiligo, so the children might also have got this genetic deposit. And loss of melanocytes, because there is a depigmentation. No, as already said, there is no pigment because there are no melanocytes. Melanocytes have been damaged or lost. What are the pathogenesis, pathophysiology, where these melanocytes are present? We'll see. You know the main, primarily three layers of the skin, that epidermis, dermis. Epi means above the dermis, so epidermis, then dermis, and then below that sub means below, subcutaneous tissue. These are the three layers of skin. In the epidermis, in the stratum basilarm, there will be melanocytes. Melanocytes will be producing melanin. Melanocytes contain melanosomes. Melanosomes will be producing melanin. Melanin pigment is distributed to the keratinocytes. For every one melanin, there will be 36 keratinocytes. So, melanin will be distributed to these keratinocytes. If there is an autoimmune antibodies, like autoimmune system, which is destroying the melanocytes, there will be no production of melanin. There will be no pigmentation of the skin or the hair. This is a pathophysiology of this vitiligo. So there will be depigmentation skin, paper white skin, and sites where it is affected mainly extensor, and it will be symmetric. If we consider this as a face and these are eyes, if these are around the periorbital area, if it is causing patches, it will be same in this case also. Around the periorbital area there will be patches, so it will be symmetric. You can see in the same image it will be mostly symmetric. This eye is also affected, this eye also, this also. And this smaller thing, no, smaller patch, you can see the small patch less than 1 centimeter, this is called macule, whereas this larger thing, larger hypopigmented area is called patch. More than 1 centimeter if it is, it's patch. Less than 1 centimeter, it's a macule. It may be macule or patch. See, appearance, how it appears: hypopigmented or depigmented macules or patches. If it is less than 1 centimeter, the hypopigmented or depigmented area less than 1 centimeter, it's macule. More than 1 centimeter, it will be patch. And it varies from millimeters to centimeter. The patch may be various dimensions. It may be having different shapes, circle, oval, or asymmetric, anything it may be. It may be having a line of demarcation and no particular shape can be said, anything. And sometimes it will be like causing itching, tingling, that is Puretic action can be seen, like a puretics can be seen. That means a tingling sensation or itching can be felt. And Koebner's phenomenon is positive in this condition. Means any trauma, any wound or trauma or scratching will causes a new patch that increases the vitiligo condition. That means it causes the spread of this disease. And hair pigment is affected. Hair also may be depigmented or hypopigmented. And choriorectis, we can see. Choriorectis means there will be inflammation in choroid and retina of the eye, so there will be loss of vision in this condition. All these conditions will be there. So if that patients with these clinical features comes to hospital, how the doctor will diagnose? We should know the diagnosis also. No, the diagnosis will be wood lamp examination. Wood lamp examination shows positive. The wood lamp exam. What is this wood lamp examination? I'll show this image. Through this scan, there will be different colors assigned for a different damage of the skin. This is a wood lamp examination. Through this we will get to know that this is a vitiligo. And amyelinosis. A means lack. Myelin means myelinocytes. Myelination is not there. Osis means a condition. Amyelinosis can be seen. And histopathological examination also reveals there is a loss of melanocytes. And it will be associated with other autoimmune diseases like diabetes mellitus, thyroid diseases, and many other autoimmune diseases also associated with, and Addison's disease. All these diseases are associated with this vitiligo. And treatment, how can we treat? We have to avoid sunlight. Sunlight from UV rays, that is from sunlight. It was protected, the melanin was protecting from us. Whenever we exposed to more sunlight, when the melanin production was increasing, and then that was protecting from us sunlight. But now there is no melanin pigment only. How can we protect from the sunlight? So we have to avoid the sunlight like that will be one of the part of the treatment. And if we have to go in case we have to go into the sunlight also, we have to use umbrellas or any cover with a shawl or anything. We have to cover the body surface. And the treatment clinically will be phototherapy. Phototherapy will be having two lines, UVA and UVB. UVA we don't give because this causes carcinogenesis. This is a carcinogenic product. UVB we will give. UVB therapy or phototherapy will be giving. This all the importance of vitiligo. Vitiligo we saw about the causes, pathophysiology, site where it is affected, and appearance or clinical features, Koebner's phenomenon, and the diagnosis and the treatment. This is all we learned in this video. If you find this video helpful, please do like, share and subscribe to my channel.